As child healthcare providers, you know the importance of the Well Child Visit to promote the healthy development and well-being of young children. The services and care provided during the 15 Well Child Visits recommended through a child's first 6 years of life help set infants, young children, and families on a positive path right from the start, long before they enter school. Unfortunately, nearly half of recommended well visits do not occur for young children. For those that do occur, many providers find it infeasible to conduct comprehensive assessments or to learn about and meet family priorities as is set forth in the National Bright Futures Guidelines. The downstream effects of these missed opportunities to promote early childhood development are monumental. Recent data shows that only 2 in 5 children aged 3 to 5 in the United States are ready for school, and 4 in 10 experience more serious social and relational health risks that impact their early and lifelong health, like adverse childhood experiences or food insecurity or parents struggling to cope. When left unaddressed, these risks diminish child flourishing, impact the nation's workforce, and result in higher avoidable healthcare and social costs for generations to come. Child health providers are the most accessible portal into the lives of young children and families. You have tremendous opportunities to promote healthy development and thriving in partnership with families and community or clinically based family services and support professionals. Well Child Visits are a high leverage, under-optimized resource in which providers can help families build on strengths and establish safe and nurturing relationships with their child. But how can we engage families to increase the number and quality of Well Child Visits? This is where the evidence-based cycle of engagement well visit planner approach comes in.
The 3-part cycle of engagement well visit planner approaches to care engages families before, during, and after well visit. This novel approach positively disrupts care delivery, helping you align with best practice approaches to care, like the family-centered medical home and growing efforts to link payment to quality of care, allowing families to take about 10 minutes to learn about well visits, complete all recommended screeners for their child's age, pick their priorities, and get results and resource links in a downloadable well visit guide. You get a clinical summary in your account data dashboard. This at-a-glance summary of screening results, family goals, concerns, and educational priorities help you prepare for and focus well visits on the family agenda and ensures high-quality care while streaming documentation, billing, and coordination with community supports. Most importantly, the Well Visit Planner ensures that families and providers share the same information and agenda ahead of time. As a result of this pre-visit investment, the time providers and families spend engaging in meaningful discussion during the personalized, connected encounter is maximized. This strengthens the provider-family relationship, potentially increasing the family's adherence to well child visits. Finally, we take partnership between providers and families one step further by providing an easy-to-use, validated digital tool to help providers and families assess and get feedback on the quality of care they receive using the Online Promoting Healthy Development Survey, or the PHDS for short. After use by at least 25 families, you get an aggregate quality report on a range of quality measures aligned with the Bright Futures Guidelines. These reports help you continuously learn and improve quality of care while deepening your understanding of the needs of your patient population.
The last 15 years of research has shown that the cycle of engagement well visit planner approach saves time for families and providers while ensuring all recommended assessments take place and that priority topics are addressed. Research documents reductions in urgent care, greater family and provider satisfaction, as well as dramatic improvements in the quality of well child visits using Bright Futures Guidelines implementation measures that you can collect using the online Promoting Healthy Development Survey. With over 92% of both families and providers saying they would recommend the cycle of engagement well visit planner approach to others, we're excited to partner with you to promote child health equity and well-being.
First, providers sign up for an account and customize a well visit planner and Promoting Healthy Development Survey. Using a unique website link, They then invite families to take about 10 minutes to complete the well visit planner, which can be done at home, on their phone, or in the office in English or Spanish. As families complete the well visit planner, they have the opportunity to reflect on strengths, goals, and concerns, learn about and assess their child's development and family well-being, pick priorities to discuss during visit from Bright Future's recommended topics, and review their customized well visit guide containing their results, educational material, and community resources. Then, the at-a-glance clinical summary is shared with providers in your account's data dashboard, helping you prepare for it and conduct the personalized connected encounter. This enhanced well visit enables you to easily identify and celebrate strengths, share decisions about whether and how to address concerns or risks, focus education and linkages to community supports based on the priorities of each child and family. Finally, you can choose to send the Promoting Healthy Development survey at scheduled intervals to best assess your quality of care and track improvement. As not only a family support specialist, but also a mother, a grandmother, and now a great-grandmother, I know by promoting the cycle of engagement well visit planner approach to care, you not only promote health literacy and advocacy for families, you empower families to take the lead in promoting their child's healthy development and family's well-being.
Although there are clear benefits of using the cycle of engagement well visit planner approach to care, you may still have some questions about how this gets implemented within your practice. To best support you during the implementation process, we provide many implementation resources, from workflows to scripts and flyers for engaging families to topic-specific family resource sheets and tips on addressing sensitive topics. You will find the initial time you invest in planning a workflow will ultimately save you time to focus on the joyful work of partnering with families to help children thrive. We also suggest that you start small by trying out the well visit planner with a few families first and seeing how it can best fit into your workday. You can then collect feedback from colleagues to gauge successes and challenges and drive change. Finally, some providers also express concern about screening for and identifying problems that can't be solved given available resources. For example, why should I screen for housing insecurity if I cannot provide housing for families? The good news is that research has shown that even though you may not be able to guarantee a new apartment for a family, offering an empathetic ear is highly valued by families and helps to build trust. And in many situations, you may be able to identify resources that will mitigate the problem, even though it can't be completely remedied. We provide you with a template for mapping existing local resources to use and share with families in their well visit guide and during visits. Families also get topic and age-specific resource sheets to help them find tools and support they need.
Existing gaps in child physical, mental, and behavioral health compel us to act now. Doing better means working smarter together. Using the cycle of engagement tools helps you engage families, improve care, streamline collaboration with community partners, and demonstrate the quality services you provide. You are in the driver's seat to promote whole child and whole family well-being. So we hope that you will give the cycle of engagement well visit planner approach a try.